This is Bob. Bob has health insurance through his employer. Bob doesn't understand his health insurance. So when Bob gets sick on a Saturday, he goes to the emergency room. This emergency room isn't in Bob's provider network, so it costs him a lot. Last week, Bob's primary care provider ran tests and diagnosed Bob with diabetes. Bob ignored his treatment plan because he couldn't figure out how to get insurance to cover the testing device. The emergency room provider doesn't know Bob's test results from last week, so he runs the tests again, diagnoses Bob again, and provides a treatment plan again. This is Health Insurance Inc. Health Insurance Inc. processed Bob's claim for the test ran by his primary care doctor. But then, Health Insurance Inc. denied payment for Bob's testing device. Bob didn't know to request the device included in his coverage from Health Insurance Inc. So Bob ended up in the ER, and now Health Insurance Inc. is paying for Bob's tests. Again. Bob still can't navigate the system and isn't doing what he needs to get healthier. The payer, they are paying too much because doctors aren't communicating and members don't understand their plans. And the provider, they're doing more, and Bob's still getting worse. It doesn't have to be this way. With the right partner, fully integrated systems can clear the path and reach beyond HIT challenges to improve healthcare for all. Offering services in payer-provider integration, care management, and health analytics, Emids can be your end-to-end partner. Now let's take a look at how Emids' HIT solutions behind the scenes could have led to a happier ending. This is Bob. Bob has health insurance through his employer. Bob doesn't understand his health insurance, so when Bob gets sick on a Saturday, he uses his Health Insurance Inc. mobile app to find an in-network urgent care center close by. Bob only pays his copay. Last week, Bob's primary care provider ran tests and diagnosed Bob with diabetes. Bob's provider is armed with analytics on population health and is able to provide the best treatment plan, drugs, and pathway guidelines for Bob. Through active payer-provider pharmacy integration, Bob's provider is able to input the diagnosis and order the appropriate items for Bob's treatment plan. Since Bob's coverage was automatically verified through payer and provider system integration, Bob got what he needed, and Bob is on the way to getting better. This is Health Insurance Inc. Health Insurance Inc. received Bob's automated claims data and clinical records with the appropriate information and was able to quickly pay the provider. Health Insurance Inc. also shared the data so lessons learned from Bob can be used to manage other members' healthcare for better population health management. Healthcare working as healthcare should. Big data, analyzed and made meaningful, leads to quicker payments, less waste, and healthier patients.